Hi everyone. Welcome, welcome, welcome. Thanks for coming to our final session in partnership with Grantmakers and Health on philanthropy and equity. Thanks for those of you who've been here, like the whole three-part series, which has been super exciting. Um, and today it's our last session, and we're really gonna get into the nitty-gritty of community engagement and philanthropy. So I'm Christopher Stoyanovsky, by the way, sorry, Research Director of Partners for Advancing Health Equity. So thank you, thank you, thank you again for coming, and I am gonna pass it over to Kate at Grantmakers and Health, who's gonna moderate today's session.
Yes, great. Thank you, Christopher. Hi, everyone. I'm Kate Trainer, Senior Program Director and Strategic Advisor with Grantmakers and Health. This is the final session in our joint workshop with the Tulane School of Public Health and P4HE. And thank you all for joining us today. It's been a great series, and we are excited to dive in with our speakers today. Throughout the series, we've explored how communities and health philanthropy collaborate with each other and learned about how funders can meaningfully engage with communities and share power effectively. We have two great speakers joining us today, Brenda Sharp, President and CEO of the Reach Healthcare Foundation, and Damon Daniel, the President and CEO of the Ad Hoc Group Against Crime. They partner together to advance work around health equity. And we're going to dive into what that relationship looks like and how it works. And we're really excited about that. But first, next slide, please. For those of you not familiar with Grantmakers and Health, I want to give just a quick overview. GIH is a national nonprofit organization dedicated to helping foundations and corporate giving programs improve the health of all people. We work with philanthropic organizations through education, networking, and leadership. We have a national network made up of about 220 partner organizations, and most of them focus their work at the state and local level. We have 5 focus areas, and this is how our work at the organization is organized, and they are all critical to achieving better health for all. And they include health equity and social justice, access and quality, community engagement and empowerment, philanthropic growth and impact, and population health. Next slide, please. Moving the needle on a large, complex social problem like health equity requires a long-term commitment. And foundations have the privilege to be able to stick with an issue and drive change for the long term. But it requires them to use their resources strategically and to build strong, lasting partnerships with a range of stakeholders. During this workshop session, the workshop series, we've examined how funders lead with trust, how they center relationships, and work to address the inherent power balance that exists between foundations and nonprofits. In our first session together, we took a deep dive into trust-based philanthropy and really explored the different principles and facets of that approach. Today's session continues this exploration. We'll learn what it looks like when health funders and community partners fully and authentically engage with one another. Next slide, please. Brenda and Damon are going to share how they are working to advance health equity at the community level and reflect on what their relationship looks like and how they've established a trusted, open working relationship. Brenda, I will turn the microphone over to you.
Fantastic. Well, thank you everyone for including us, and thank you, Kate, and our colleagues at Grantmakers and Health, where Reach has been a member almost since our inception nearly 20 years ago. It's been a great organization to support the work that we do at a regional level. I'm Brenda Sharp. I'm the President and CEO of the Reach Healthcare Foundation. I've been here 20 years. So I am very excited to share with our audience and listeners today some of our journey on the road to trying to become a better partner in health philanthropy and making our attempts to be more equitable in our practices more real. And so I'm happy to be here. First, I'll just share quickly a little bit about the Reach Healthcare Foundation. We are a conversion foundation. We came out of the sale of a large regional nonprofit hospital system here in the Kansas City area to a for-profit health system. So we are a conversion foundation. We have about $140 million in assets, and we invest about $4.5 million in grants and technical assistance and other supports annually. We have a 17-member board of directors, pretty large, and 7 staff, pretty small. We try to look bigger than we are and to do work that is leading edge, we think, in our field most of the time. We have a 6-county service area spanning Kansas and Missouri. The first thing Damon and I want you to know is that when you say you're from Kansas City, it may mean you're from Kansas City, Missouri. It may mean you're from Kansas City, Kansas, or maybe some suburb around there. So we just say Kansas City in general when we talk about our service area. Our vision is that all people and communities achieve equitable health outcomes. And our mission is to advance health equity through coverage and care for underserved people in our region. And this mission was essentially handed to us out of a court settlement agreement when that sale happened. And so that comes into play later when we talk about why we were kind of narrowly focused on health and healthcare access in our early days and how we've evolved over time. Next slide, please. REACH does strategic planning about every 5 years with this board. It's important, I think, for philanthropy to not change its mind every year about what it's going to fund. And it's confusing for grantees, it's confusing for staff, it's confusing for the board. So about every 5 years, we engage in a large-scale, year-long strategic planning effort that revisits our legal requirements and our mission and our past work and our ideals and goals for the future. We then turn that strategic plan into an expression of that in what we call the community investment framework. And so this helps outline for staff what we can say yes to and what we have to say no to ultimately. So I wanted to give you that context so you can see where some of our work is reflected in each of these areas. But it is important to note that one of our mandates, if you will, as part of our mission is to improve the health insurance coverage rates in our service area. So that's something we're always trying to keep in the back of our minds is how can we reduce the rate of people who are going without access to affordable health coverage. And then we also aim to increase access to quality, culturally appropriate health and human services and whole person care for people who are vulnerable in our area. We have 3 outcome investment priorities: strengthening the safety net. This is probably what I would consider our bread and butter. We do a lot of core operating grants in this. About almost 40 to 45% of our funding is made in unrestricted 2-year renewable core operating grants to partners that you would expect for a healthcare foundation like Safety Net Healthcare clinics, community mental health centers, et cetera, and advocacy organizations. I'm skipping over to the right to our Bridge the Coverage divide. Again, kind of bread and butter, what you would expect. If we're trying to reduce the uninsurance rate, we're trying to connect more people to what is available to them publicly: Medicaid, healthcare.gov, SNAP, CHIP, TANF, whatever programs and services they might be needing. And we do a lot of public policy advocacy around issues like Medicaid expansion and implementation in Kansas and Missouri. Close the health equity gap is our attempt to express our ideals and our goals to build capacity and leadership in organizations that have historically been underfunded, under-resourced by not only REACH, but lots and lots of other philanthropy and government investment. And this is, in fact, where the work that we're going to talk about next sprung out of. Our Centering Black Voices initiative is nested in the Close the Health Equity Gap. And the only other thing I'll say about our community investment framework, for those of you who work in philanthropy and are interested, our board actually takes this, and our staff takes this community investment framework, and under each investment priority lives about 10 specific strategies that we've researched and developed and the board has adopted. And those are actually expressed directly in our budget. So every strategy is reflected in the budget and then projects and initiatives within that. So it's a little bit different way about, marrying your budget and your money to your mission. Next slide, please. So the Centering Black Voices initiative was really envisioned by Carla Gibson, our wonderful Vice President of Programs, who's been with the organization for almost 18 years now. And Carla came to me in 2019 and very specifically said, we are not doing right by Black-led, Black-serving organizations in our community. We have been underfunding them. Carla, who is Black, was feeling even more intensive pressure in the community because of her role with the foundation, and feeling a mismatch between what Reach was wanting to do, saying it was doing, and what that felt like on the part of organizations that we were, again, not funding very well or often. She did a series of interviews with Black leaders of nonprofits in our community and said, what should we be doing? How could we be doing this differently? And I want to note, this was all before the summer of 2020. This was something that she had launched and did some interviews, and including folks like Damon, who was with an organization that is beloved and revered in our community, but we were not funding them due to our kind of narrow perspective around health and healthcare. Based on that feedback, we launched an initiative called Centering Black Voices. This was a 2-year pilot, and it had several aims. One was really inward. It was looking at ours and mine and our staff's implicit biases, our role in advancing philanthropic redlining, and our role in perpetuating racism and underinvestment in the Black community and other communities of color. This involved a lot of work with our staff, a lot of reading, a lot of reflection, a lot of difficult conversations, a lot of training with our board, not just one time, but it was literally over the course of a year, and a very deep dive in those aspects. We also wanted to address the power dynamic between the foundation, Reach specifically, and Black-led, Black-serving community partners, and start incorporating trust-based philanthropy. And so you all heard about, it sounds like from your first session, we brought Brenda Solorzano and others from Trust-Based Philanthropy initiative, and really did a deep dive on our own internal processes and the things that we were doing that were creating unnecessary barriers, and thinking about how we use the tools that are at our disposal differently. We also wanted to reduce barriers for small Black-led, Black-serving organizations that are trusted in and by the community to receive funding and other sources of support. So this wasn't about who we trusted, it's about who the community trusted, and who they routinely went to for help, assistance, support. And then ultimately, we wanted to increase our investments in the Black community. How many dollars were we actually moving in new directions? Next slide, please. So the key elements of the Centering Black Voices pilot was, one, we gave unrestricted support for core operating needs to a cohort of Black-led, Black-serving organizations. And I believe we started with 9 or 10, and we ended up with around 8 or 9 core groups that we gave unrestricted support to. And this is very unique still in philanthropy, to have no strings attached. I think most organizations are accustomed to having to justify what they're doing through their, a program or a particular staff person. And we wanted to say, we just value the work that you're doing, and you can use it for what you need. We also wanted to provide timely access to capacity building supports like supplemental funding. So some of the organizations said the core operating is great, we need that, but we also need a little bit of money to improve our accounting system, or we've never even had a donor database to track donations. We provided to them a consultant that we retained and vetted, who was trusted in the community, to go and work with organizations and help them identify their needs and tell us what they needed, and we would fund that. And then opportunities for leadership development, professional growth, and networking. So not necessarily a community of practice, but really developing a network. And surprisingly to us, probably surprisingly to me, a lot of Black leaders of organizations in the community were not meeting amongst themselves or having spaces where they could do that, or spaces that were paid for that allowed them to have very great, just socialization, just networking, without an agenda, without bringing people together to say, we need this from you, not something extractive, but allowing them the space to just develop and maintain supports and friendships and professional colleagues. Next slide, please. So what we've learned is, and Kate, I think, and our team at Tulane has provided to you all what we call our Centering Black Voices Black paper that we highlighted in a Views from the Field at Grantmakers in Health. If you're not familiar with that publication, I encourage you to take a look. I get great stuff from my colleagues across the country all the time there. But the importance of unrestricted funds. We actually had over 15 years of experience in providing unrestricted funds. We just weren't providing many of them to Black-led, Black-serving organizations. We had very burdensome restrictions and eligibility requirements that they were unable to meet, and so we needed to address that. For instance, a lot of organizations that we worked with in this cohort had not yet obtained their first audit. And we always required an audited set of financial statements for organizations over a certain budget size. And as you know, many times money kind of pours in at once, and an organization goes from being $100,000 organization to a $500,000 organization almost overnight. So those unrestricted funds were very important. To have very small needs-focused grants, that was very important. And for capacity buildings in areas like governance, finance, fund development, and communications. But it was not always accessible, and it was not always provided by consultants that were culturally appropriate or even known or trusted in the community. And so we've worked to build that angle as well. Combined support leads to optimal results. So the grantee partners that we worked with that utilized multiple supports and resources, grant making, technical assistance, leadership development, networking, they experienced more significant and I think lasting improvements in various areas like their process infrastructure, staff capacity, relationships, monitoring, evaluation, et cetera. There are limitations. I think everybody knows that's no secret on one-year funding. You can't expect a lot to happen in 1 year. And more than that, foundations like REACH can't expect one grant to change the world for an organization and can't shouldn't expect the kind of hopping around and jumping through hoops that are required of many organizations, but especially Black-led, Black-serving organizations who typically have very few staff, maybe one or two founding staff. They're in a growth mode and they don't have time to go around doing all these applications and reports and whatnot. And then expecting that 1 year grant to noticeably change the trajectory of that organization's capacity is really unrealistic. We learned the value of culturally responsive coaching. We engaged 2 external consultants during this pilot with deep experience in advancing equity and were trusted in community. They guided as in tandem the internal work of the foundation, but then also the external convenings and technical assistance to our grantee partners. And then healing for Black leaders. And this is an area where I think it was a big reckoning for me, how much damage had been done by the foundation and other philanthropy on Black leaders, to their morale, to their networks, to their faith in funders in this community. So it was really important that we provide some supportive spaces for those individuals to connect and develop professionally and grow personally. And where I don't come, it's not my space, it's not my place. That was, I think, very, very important, humbling experience, but very, very important. Next slide, please. So where are we today? We took that 2-year pilot and turned it into multiple lessons that we have incorporated in our work overall as a foundation. We still have a long ways to go, but I wanted to share some of the things we're most excited about that are very practical and tangible. Our board worked diligently over the course of that year to develop what we believe is an informed racial equity narrative, instead of just a statement about this is important to us or this is really beyond our vision and mission statement. And this was very challenging for a board of 17, many of them who had been here for several years and were asking questions of themselves and us. Does this mean we were racist? as a foundation. These are very challenging things to grapple with. And we came to the conclusion that yes, our practices had been, in fact, deeply embedded in institutional racism, and we had to address that and own that and continue to work on that. We have a CBV advisory group. This is a subset of our board of directors who are all Black, who are involved in various professions and aspects of our community, and they guide the staff in our thinking about this, and they serve as a bridge kind of between the board of directors and staff. We have incorporated more multi-year unrestricted core operating support, and we have added more Black-led organizations into that core operating portfolio. We have developed an internal dashboard to track equity investments, and before anybody asks us for it, no, it's been really challenging for us, and we are still working on how we track, how do you count an organization as Black-led, Black-serving? What if that organization has a transition in the middle of our work with them? You know, how are we developing and thinking about our pipeline of Black-led, Black-serving organizations? How do we count technical assistance versus grant making? But we're getting there, and I'm very, very proud of it. But man, we are digging into some hard work there. Core consultants. Out of the consulting engagements we had as part of CBV, Carla then took it a step further and went out and identified 5 key consultants who are Black, who have extensive experience in various areas of capacity, and the foundation engages them and pays them. And then Carla works to bring Black-led, Black-serving organizations in connection with those consultants based on what those needs are. And that includes communications, fund development, accounting and finance, I'm gonna blank on grant writing, and governance. And so that's been a really great match. And I will just say, from a philanthropy perspective, one thing that changes for foundations is how you count your expenditures, because we have struggled with this. It looks like our grant making has gone down because our consulting costs have gone up with this particular effort. And our board wants to continue that. So we're looking at ways that we count that technical assistance potentially as in kind on our financial statements now. And then we've learned we have to do board education and re-education to preserve and protect what we've learned. Like most foundations, our board has term limits. They can serve up to 2 3-year terms. That goes pretty fast. And so you're constantly onboarding and bringing in new board members and educating them about how far we've come as a foundation. And we need them to come in where we're at now, not having to bring everybody up to speed. So it's changed our recruitment priorities for the board and the way we onboard as well. Next slide, please. And I think I'm done now. So I'm really pleased to have Damon Daniel here from Ad Hoc, who was one of the organizations that said, okay, Reach, we've known you a while. We'll go along with this endeavor. And I'm so pleased that Damon did, and he's been a good support colleague and friend to this foundation and to this particular body of work. And I asked him to join us here and to be honest, so he can say things that might hurt my feelings otherwise, but it's okay, I'll get over it. I'm not as fragile as I used to be. And so I'll turn it over to Damon.
Thank you, Brenda. Let me just say that for those of you who have joined us, thank you for including us in this presentation as well. But I just want to say that the Reach Healthcare Foundation has been a great leader in the philanthropic community here in Kansas City. And a lot of that has to do with the leadership of Brenda as well. She's very humble, but they are making great strides in this effort to reach leaders of Black-led leaders of nonprofits. In addition to, this issue of racial equity, particularly when it comes to funding. And so they've been really great, and it's been remarkable to see the work and progress that they've done as a leader here in the philanthropic community. And I'm not just saying that because we're a grantee. I'm really just saying that because Having been involved with nonprofits for over 20 years, I've really seen the evolution of the philanthropy here in Kansas City. And there are still just a handful of foundations, but significant foundations like REACH that have evolved and went to this trust-based philanthropy, as well as putting racial equity at the center of their work. And so it's just extremely important to just acknowledge the great work that Brenda has done as a leader of Reach Healthcare Foundation as well. And to the folks at the Grantmakers in Health and Equity, thank you for inviting me to be a part of this as well. For some, just so you know, the ad hoc group against crime is really for victims of violent crime and their families. Ad hoc is the sort of Kansas City Center for Healing and Justice. For some, we serve as the emergency room for social services, and for others, we serve as the trusted bridge between the community and the criminal justice system. And so for what that means for some on the healing side of things, you can go to the next slide, please. On the healing side of things, we provide a variety of services within prevention. We do healthy relationship classes, grief counseling. We even do neighborhood block watch trainings, and even crime prevention through environmental design. On the intervention side of things, we do what we refer to as hospital-based violence intervention, which is a program where if there are youth or young adults who are intentionally injured, whether there's a gunshot wound or a stabbing, we respond to the hospital, to the bedside, to make sure that those individuals, especially those who are waiting in the emergency room, don't retaliate, in addition to making sure that those folks who, upon their release, have much needed services and are able to navigate and access social services as well. We have a Fresh Start program that is really geared towards helping folks who are still in the midst of crisis, whose lives are still at risk. We move them, and what we refer to as we're saving lives in real time. So we will put folks up into a hotel. This is a referral that we receive either from a prosecutor's office or for the police department directly, or some of our other community partners too. And so we do a lot of what I refer to as crisis case management in that case. And if there's children involved, we're making sure that they still are getting access to their homework and their food is provided. And then even after we do a relocation, then we're making sure that people are on solid footing as well. Excuse me. Next slide, please. On the justice side of things, we do a variety of services that include working with law enforcement to help solve homicides, unifying families when it comes to missing persons or youth runaways. We recently launched a YouTube series called Open for Justice. That's really to kind of highlight some unsolved homicides as well as missing persons that are considered cold cases. And then on the intervention side, we do employment readiness. We work with various employers and workforce development agencies for career pathways. We do internships, and we work with financial institutions in connecting people who are unbanked and getting them banking accounts as well. And so those are just some highlights of some of the services that we provide at the Ad Hoc Group Against Crime as well. Please, next slide. I want to just kind of hone in on a few things. I mean, there's so many things that I can lift up as it relates to our relationship with REACH, and Brenda alluded to some of those. But when it comes to the Centering Black Voices, we are one of those agencies that receives some core support. And that is extremely important for us as an agency, especially when it came to us looking at how we're building our capacity. We've been around for 47 years, actually be 47 years next month, serving the Kansas City metropolitan area. We cover 5 counties. And we are still a very small organization. We have about 12 staff, which include 3 licensed counselors as well, and case managers and whatnot. But for us, in looking at core capacity, oftentimes it's hard to find funding for grant writers and things like that as well. Sometimes when you're engaging nonprofits that are Black-led, you'll find that many of the leadership is either involved in day-to-day operations and or especially some of my colleagues that have founded nonprofit organizations, we are often led by the mission. We either have an experience that has attracted us to the mission of the organization, or the birth of that mission has come out of our own personal experiences as well. And so when you're investing in a Black-led organization, you're getting folks that are really deeply rooted in the community and addressing the issues themselves many times. For us, we really utilize the core consultants for marketing and redoing our website and advertising. As a 40-plus-year-old organization, one of the things that has always been concerning for me is keeping up with the times. And especially when you talk about social media and online presence and things like that. So for us, it's been really refreshing to have access to a marketing firm that can help us with keeping up with the times as it relates to redoing our website, doing our brochures and things like that too. So that was extremely helpful. I would say that the core support has also been around Reach working with us and thinking outside of the box. And I say that because I had a conversation with Carla, this was a few months ago actually, and I was telling her that 85% of the people that we serve are no stranger to violence. Either they've lost a loved one to violence, or they've lived in a community where violence is a constant. And so for us, I began to really look at this issue of generational trauma. And for those who are really unfamiliar with it, generational trauma really begins with when a group that has collective experiences, whether it's horrific events such as abuse or discrimination, racism and things like that. And then those experiences lead to, anxiety or depression or post-traumatic stress disorders. And those folks that are directly impacted by that then pass that trauma on to their offsprings and so forth and so on. And there's really no diagnosis for it. And so as I was having this conversation with Carla about this issue, I began to kind of lay out our strategy for which I'm really planning to look at how we disrupt generational trauma. And so that's been very unique in terms of being able to have the funds that are really assisting us with our strategy. And our strategy has been sort of, I would say, so I'll break it down to maybe 3 steps. One, in terms of, surveying our clients, identifying those clients, as well as co-collaborators. And then, doing more community engagement, holding community education and conferences and seminars to really dig into this. Back in June, we brought in Dr. Joy DeGruy, who's a well-known researcher and author who also authored the book Post-Traumatic Slave Syndrome. And we were looking at really driving home this issue of not really having a diagnosis for what we see on the in an everyday basis. And so part of what we're doing is developing a tool, an assessment to assess generational trauma, and then look at how we develop resources to deliver real healing and justice that's related to disrupting generational trauma for us as well. And so that out of the box funding and thinking with us and partnering with us have been very, very priceless, and some, I would say, valuable. Also, recently, or actually last year, we received some core support as it relates to our retention and wellness of our employees. And there's been so many times where when you have an organization like Ad Hoc, where you have individuals who, are, going through secondary trauma, and it's difficult to keep people in this work. And so we have built in, days off and things like that. And during the summer, I give everybody, the first Friday off of the month so they can rest and come back to work refreshed. But Reach has been very instrumental in helping us be more intentional about how we invest in the wellness of our employees. And so this last year, we were able to do 4 separate events where we gave folks, gift cards, or we invited families to be with us. And we really focused on the wellness of our employees. And that was the first year where I really saw an increase in commitment and productivity within my employees too. And I think that that's just been very valuable when you talk about the true investment within the organization too. So I'll stop there.
Terrific. Thank you. And thank you, Brenda. So we have some time for discussion. We want to make sure that we left ample space to have a good discussion and a rich discussion. So please feel free to put a question in the chat or a comment, or you can raise your hand on screen and we can start our discussion. We already had one post in the chat. Damon, could you share a little bit more information about the assessment tool that you mentioned
Sure.
in
Sure.
Dr. Deguri's work?
And so on one hand, what I mentioned is there's no diagnosis for generational trauma. And so many times when we do our intakes are very general, and we're really not getting to the core issues of what people are dealing with when we talk about whether they're some of the choices they made, their family histories and things like that. And so this next year, what we are doing, thanks to the help of Reach Healthcare Foundation, is investing in the development of that tool, which begins with doing client surveys, interviewing our clients, interviewing community stakeholders, and doing more community education. We brought in Dr. Jagru back in June to help inform a lot of those conversations as well, especially among some of our partner agencies. And so we don't have the assessment tool just yet, but that's something that we're in the process of creating, and that'll be based off of this year-long survey and what I refer to as a listening campaign and community education as well.
Great, thank you. Terrific. So as I said, please feel free to put a question in the chat or raise your hand while we're waiting for folks to kind of sift through their questions and frame them in their mind. I do have a couple of questions for Brenda and Damon. One is kind of thinking about your staff and Brenda, how the shift into trust-based philanthropy has changed the way your staff does their work. If you could provide a few insights on that.
Sure. I think this has been an interesting time. I think when you combine the summer of 2020 and the horrific events preceding that and during that summer, the murders that were happening across our country and raising consciousness, and then a pandemic, a lot of our philanthropy colleagues and Reach changed our grant making practices almost overnight, like made our applications really easy, and we stopped asking for onerous reports and those kinds of things. And after the pandemic ended, or as it was nearing, we all kind of sat down and said, why did we need all that stuff anyways? And why were we putting the onus on the grantees to provide that? We are paid more. We have more resources, we have more capacity typically than many of our grantee partners. So we put the onus on staff to do due diligence. So it means that instead of having organizations prove to us they're worthy, we go out and so we are scouring websites, Facebook pages, we're calling people in the community saying, do you know about this organization? We're calling back and asking questions. We didn't see the connection to health here. Can you help articulate that so we understand it better? So I would say that's one thing. It really shifted the way, it didn't shift our staff size or the job titles. It shifted the way we do our work. Instead of kind of waiting to be on the receiving end of all this, I think it feels much more fluid. I would also say, I do think we've been doing this for a very long time. I tend to only hire people on our staff who have actually worked in the nonprofit field. They've had to sing for their supper once in a while. They've had to write a grant. They've had to lay awake at night going, how am I going to make payroll? Can I fulfill these grant obligations? So thinking about the way we communicate with grantee partners, that it's okay to tell us the dirty laundry stuff or the things that aren't going well. They don't always have to tell us what's great about it. I think that builds trust, and we encourage our grantee partners to tell us the bad stuff, because sometimes that's what really needs the funding, is to address that broken thing that just keeps making all of this work harder and harder and harder. So thinking about the way staff interacts and communicates, I would say for us would be the difference.
And Damon, is your staff doing their work any differently in terms of their relationship with Reach? Or how you communicate with Brenda and her staff, the work that you're doing?
No, not really. I think that we've always sort of continued to keep Reach in the know and inviting them to events and things like that where we can. Particularly even with the this movement that we've launched to disrupt generational trauma, has really been about, you know, us making sure that the community knows that this is a partnership between Ad Hoc and Reach as well. And so doing that too. But I think just taking a step back, oftentimes, Reach is one of many of our foundations that we work with or that support us. And so not all of our foundations have come over to trust-based philanthropy. And so we still do a lot of data tracking. We still do a lot of reports. And so that same information we keep and we still provide when asked to Reach as well. But it's been really great that we were able to kind of sit down in person and have just a conversation about where we are, what we've been able to accomplish, and then to be able to produce some of the hard data as well. And so recently, though, because I've been in nonprofits for quite some time, and I'm still I still go by how I've been trained as it relates to keeping data and doing reports. I've recently partnered with a research company to help us better tell our story, as well as help us come up with better tools to evaluate the work that we're doing as well. Because to me, it's still super important, especially when you're doing work around violence prevention and you still have high rates of crime and violence, and that are still on they're still on the rise. It's hard to say to some folks that the work that you're doing is still being effective. And so for us, when I say to a funder or to even a reporter, whomever, that we're saving lives in real time. 1 month we relocated 15 individuals who had been targets of violent attacks, meaning that they survived an assault. Some of them were shot, some of them ended up in the hospital, and then we moved them out of that very dangerous situation into a hotel, and then helped them with rent or something like that as well. But for us, it's all about how do we then make sure that we have something in place where we're keeping in touch with those individuals and we're not just moving from one crisis to the next as well. And that kind of goes back to this issue of us really looking at generational trauma and the fact that many of the folks that we're serving are no stranger to being impacted by violence as well. And so that for us is always going to be part of our culture in terms of making sure that we're being very responsible and transparent with the dollars that we're receiving, but then also that we're able to communicate the work that we're doing and the impact that we're having in the community as well.
Yeah, thank you. It's sort of related.
Sorry, can I jump in? I had a question
Sure.
around. So Damon, you made a mention that some of your other partners, philanthropy partners, don't do business the same way as Reach. Can you talk about what those differences look like in your interactions, like with Reach versus them? Yeah, like how are things different with Reach moving to this trust-based philanthropy model?
Sure. So some of our funding is government funded. Some of our funding comes from the city. Some of our funding comes from the state. Some of it is passed through dollars from federal. And so because of those government funds, we have to produce specific things to be accountable for taxpayer dollars and those sorts of stuff too. So there's a lot more scrutiny involved with making sure that we're tracking and doing what we say we're going to do. And so that's why I say that practice of continuing to do those reports still keeps us in line with making sure that even when we have more foundations like Reach and wishing that we could have more foundations, like Reach that are doing more trust-based philanthropy, there's a huge difference. And so I don't know if I answered your question, but that I think is really about, you know, there's still more funders that require reporting than those who do not in the traditional sense.
Have any of your learnings, Damon, from the work with Brenda and sort of how the foundation does it work, have you been able to translate those over to any of your other funding partners?
Yeah, I think so. I would say, especially when it comes to site visits, I have seen and experienced more of those, or some funders wanting to do more site visits. And so because we've been doing a lot more of that with Reach and some other foundations here in Kansas City, being able to structure that in such a way that we're telling a story versus just presenting numbers has made all the difference too.
Great. Thank you.
Hey,
My next, oh, go ahead,
I
Brenda.
was just gonna add, we
Yeah.
did change our site visits structure quite a bit to just really to be centered around 3 questions, you know, tell us what's going well, tell us what's not, and how are they addressing health equity? We can do that via Zoom, we can do that in person, trying to be very responsive and make it less of that very stressful, like some kind of an accreditation visit or something like that, along those lines. I don't know if Damon experienced that or a change, but we did make some changes in that process as well.
Thank you. I'm wondering if you could share, Brenda and Damon, maybe some of the sticking points. What were some of the places that were a little bit harder as the work started to move forward, where you found yourselves maybe it was a little bit harder maybe to get on the same page, or there was a hurdle to be overcome?
Yeah, I think this isn't necessarily to ad hoc, but I think ad hoc experienced this as well with our foundation having that very narrow definition of healthcare and access and looking at uninsured rates. Imagine how Damon's going to tell me he's impacting the uninsured rate in our 6-county service area. That's not a data point that he's able to track or demonstrate. He is and his staff are doing tremendous work in mental health services with families who are experiencing the worst crisis of the, you know, something unimaginable. And so we had to think differently about that. But I think one of the sticking points that Carla regularly reiterated to me and to the board was that there's a lot of fear and warranted lack of trust in the Black community with philanthropy. And Reach can say it's going to do this, and somebody can say they put health equity or racial equity in their statement or their work, but they are very accustomed over decades of real experience of money coming in, money coming out, money coming in, money coming out, and this ebb and flow. And, you know, it's like, how long are they going to stick around? And I am sure that was present. You know, Damon and his predecessor had visited Reach multiple times to request funding, and the answer was no. We said we couldn't, it wasn't a fit. And how many times do people go back to somebody who just says no? Damon, luckily, is an extraordinary individual and a very resilient person and fundraiser. And so he would always come back, but that takes a toll on people. It's very demoralizing and it's frustrating when you know you're doing good work and funders just aren't seeing or understanding that or creating a path for you. So that I would say that's been a sticking point, is how do we overcome that past damage, the past lack of distrust, and then we have to constantly work on that, and that it can't be based on one person. So Carla is wonderful and she's very trusted. It's important to me that I have her back, that our board have her back, that this isn't just about one person's passion and investment, that it's organization wide. So that would be my comment. Damon, what do you think?
Yeah, I think I agree with that. I think just for some context a bit, So prior to me coming to ad hoc, the previous organization that I worked for, we had a relationship with Reach. And so when I left that organization to come and take over ad hoc, I just assumed that, hey, I need to make sure that ad hoc is on you all's radar. You know, we're doing some great things. And it was just one of those opportunities just to kind of check the pulse and see if there was some interest and some alignment. And I was told no, there wasn't. And I think what I learned very early on was I really wasn't speaking the language of the foundation as well. And I didn't really have anyone coaching me through that. It was one of those experiences where I was like, wait a minute, I thought that violence is a social determinant of health. And so I thought that this could be an opportunity, and we're providing counseling services and isn't that something, but I just didn't have the terminology. And plus, you know, I was also working or taking over an organization that had a reputation in the community that preceded me in my time, and I had a lot of I would say, gosh, I basically had to reintroduce the community to who ad hoc was or is. And so that took some time. And I think that staying in touch with Reach and with Carla over the years and inviting them to events so that they can kind of see what we were doing also helped in that regard. As I mentioned, I was kind of brought up in the institutional way of raising funds. And there's always this thing that talks about where when it comes to fundraising, especially when it comes to engaging folks, that the real power of fundraising rests in relationships. And I didn't really have a lot of relationships. I had the relationship with Carl, I had the relationship with some other foundations that we came with. But when you talk about most Black-led organizations or folks that whose own experience is rooted in the mission of the organization, people with deep pockets aren't necessarily connected to that. And so that's always been a struggle, making sure that we have those kinds of relationships or knowing somebody who knows somebody who does. I think I was fortunate to take over an organization that was founded by a former police officer and a former elected official and someone who had some connections that could show me around or introduce me to folks, but I still had to introduce myself to folks and show that I had some credibility as well. And so that's not everyone has those that kind of access either. And so, but yeah.
A really important piece about those relationships. You know, how do you begin to build those relationships and how important they are? The next question is about
Kate,
DEI.
here?
Oh yeah, sure.
We are almost at time.
Yes. Yeah, one question that
Okay.
has been in the queue about the DEI backlash that's been happening, and that is causing concern among health philanthropy and the nonprofit sector. And I just wanted to see how Brenda and Damon, it was impacting your work.
Well, Kate, I'm glad you asked this question because we just hosted two workshops 2 weeks ago, one for philanthropy and one for our grantee partners. And there is very real and valid fear in Kansas and Missouri. We have very specific legislation that has been passed attacking DEI programs, particularly at academic institutions and hospitals that are providing gender affirming care, especially for teens. And I think this is something where philanthropy is going to have to wake up real fast and recognize that this legislation is all model legislation. It's national, and if it hasn't come to your state, it will be. And it creeps in, it's insidious. It has to be tackled full on. And so it's changing the way we are even thinking about our public policy agendas. We've never put language in our policy agenda that says we will, oppose any legislation that seeks to, advance anti-DEI legislation. Before it was, we were, promoting promoting policies that promote DEI in our institutions. And so that it's a very real change. And I think we all need to get aware real fast.
Yeah, I was just say ditto, and I know we're almost at time. The only thing I was just say and add to that is that, following the murder of George Floyd, we did see a lot of folks shift their attention and make donations and or make one-time gifts, and trying to continue those relationships have been difficult because folks have now began to revert back to those traditions and those other ways of funding as well. And so some of it is drying up as well, and then beginning to question what the commitment really was to begin with.
Thank you. Well, thank you. I really appreciate Brenda, Damon, your time and your reflections. I know we're at time, so I will kick it back over to Christopher.
Thank you, Kate, and thank you, Kate,
Yeah.
for that question.
I think we could have kept talking, but
yeah. So I just want to say, everyone, thank you, especially Damon and Brenda for today's session, but also Kate and Arpita, our partners at Grantmakers in Health. And thank you everyone for coming and sticking around with us during this 3-part series. Before we head out, I want to share some things. So please take the Endo Workshop survey. There's a QR code up on the screen and in the chat. We love to hear what you all like to learn, and we use that for our programming with you all. And then also related to this series, so what's going to happen from here is we take all 3 recordings, we're going to clean them all up. They get edited, we know parts where things go silent or something like that. We make them all pretty, and then we'll share them together with a couple other documents that will live together as a toolkit that kind of summarize things that we learned in the series, but then also this additional document that's really around kind of next steps or guidelines or things to think about when putting into practice trust-based philanthropy, community engagement, and shifting kind of policies related to philanthropy and grant making. So be on the lookout for all of those. They will be coming out in the newsletter, and they will also live in the resource library on the Partners for Advancing Health Equity website. And I thank you again to Brenda and Damon and Kate and Arpita. And also there's a whole team behind the scenes. Brianna, thank you. Michaela as well on the Partners for Advancing Health Equity team. That's what we have for this series. Thank you for the lovely chats, folks. I really appreciate getting those. I got some chats from everyone. Yeah, thank you. I'm so glad you all like the series.
Thanks for including us.
Thank you.
Oh, my pleasure. Our
thank
pleasure, our
you.
pleasure. Thanks, everyone.
Bye-bye.
Bye.
Bye.